planning for the future. There will be a time where we can get together either in small groups or bigger groups. And this might be a perfect time to be doing the work that it takes to get an Alzheimer's Cafe started. So I'm really excited to share our experience and some of the best practices that we have found, and also others have that we've collected from other Alzheimer's cafes. So an Alzheimer's Cafe is a very, I call it a simple yet profound program. It's very accessible. It is, I don't want to say easy to start, but it is something that doesn't, other than time, it doesn't, of somebody to work on it, it doesn't cost a lot of money. And so I think it is a great way to start dementia-friendly programs. So we'll go to the next slide. So what is an Alzheimer's Cafe? First of all, we have always called ours an Alzheimer's Cafe, but many times people call them memory cafes. There's different reasons for that. Sometimes using Alzheimer's in the title can be challenging for some people. They may not feel like they want to participate. On the other hand, part of what an Alzheimer's Cafe can do is break down stigma. And so we chose to call ours an Alzheimer's Cafe, but Memory Cafe is also used. And it is a program that is usually in a community space of some sort, like a coffee shop or a library. It's been in museums, community centers that might have a cafe. And it is really for the person with dementia and their loved one or a friend to come together and have an opportunity to socialize in ways that we all socialize, in public, in groups. Difference is that it's a supportive space, which we'll talk about in a minute. And it's just a place to have good food with good friends. And in some ways for dementia to not be in the room at that time. It also, by being in public spaces, it's an opportunity to educate and continue to work against stigma around Alzheimer's and dementia, as well as an opportunity to work against ageism, which our society has. And it's also an opportunity, being in a public space, to connect with the business community. Community businesses, and also have them support people and learn about people living with dementia. And it's an opportunity for people to share community resources with one another. It is a particularly supportive for caregivers. They have an opportunity to talk with one another and learn from one another in a social environment. Next slide, please. What Alzheimer's Cafe is not it is not an adult day program. It is not a drop-off program. So people living with dementia come with someone, a loved one or a good friend. It is also not often a program that memory care residential community would bring people to. It's not that it doesn't happen. It can happen, but the idea is that it is really a social time for caregivers and their loved ones. However, a professional caregiver could conceivably bring someone to an Alzheimer's Cafe. It happens a lot, but it would not be likely and probably not work as well if it was one person who brought 3, 4, 5 people. It is really not meant to be used in that way. It is sometimes people who are living with an early stage memory loss do come to Alzheimer's cafes, and they sometimes come by themselves because they are able to. So that is something that definitely can happen, but it isn't an adult day program or a drop-off program. In our Alzheimer's cafes, we generally are not doing, medical or professional advice. Again, there might be some sharing of resources, depending on if there's, in our case, we have our social worker or our memory loss programs coordinator there, and they may have some resources or advice, but it's really not a place for professional advice. And it is definitely not a marketing opportunity for any particular agency or services. The reason that's brought up is because sometimes you might, want to have a sponsor for an Alzheimer's cafe, and that's actually okay. And I'll talk about that a little bit later. But if they're going to be there, they're there to just be social and connecting in a social environment. It is not an opportunity for marketing. Next slide. So just a little bit of the history. The Alzheimer's Cafe movement started in the 90s, late 90s, in the Netherlands by a Dutch psychiatrist. And that style is sort of known as the European model, and I'll explain the difference in a minute. But the first Alzheimer's Cafe in the United States was in 2008 started by Dr. Jutta Luchvig. And her style is more of what we call the American model, which again, I will explain in a second. And we were really proud that our center was the second in the United States. It started here in Seattle in 2010. And before COVID, there were over 20 happening in Washington State. I have to say that how we got connected to Alzheimer's Cafes is a lovely story, in that we had a couple who would go to England pretty regularly, because she was from England and her husband is the one who had dementia, was living with dementia. And she came back from one of their trips and told our social worker and myself that she had been to something called an Alzheimer's Cafe. She, of course, said it with a beautiful British accent, and it was held in a pub. And she really wanted to know whether or not we could conceivably have something here. And so that was in 2009. And by 2010, we had our first Alzheimer's Cafe. Next slide. So just a little bit of the difference between the European model and the American model. The European model is more like a program set up in a community setting, but it is actually more formal presentations about Alzheimer's issues or caregiver issues, and then it's combined with a social hour. Whereas the American model, again, under first Jutta Luchvig, and then we decided to move in that direction, is really focuses first and foremost on the person. So it's really an opportunity to have a little bit of respite from the disease, to have a place, as I mentioned, where Alzheimer's really isn't in the room or dementia is not in the room. It's really for the person with memory loss and their caregiver or their good friend to enjoy what we take. I guess we're taking it more for granted now during COVID, but what we take for granted is just having social time in a cafe or a restaurant with friends and conversation. And we often do music as well. And that the staff or volunteers are there just to be create a supportive environment, to create a supportive environment. Next slide. So why start an Alzheimer's Cafe? I think many of us can say exactly the reason why, is that people who are diagnosed with dementia and their care partners are really hungry for social events, and that they want something different than just support groups. It is important that couples and friends and family have something to do together that they both can enjoy. And as I said, dementia is not in the room at a cafe. It's really food and friendship. And I will tell you that I have been to many an Alzheimer's Cafe where I walk in all honesty, I wouldn't be able to tell you who the person is who has the dementia and who is the care partner. It can bring out for the person with dementia an opportunity to be social. And as I always love to tell a story that we had a woman in one of our Alzheimer's Cafe who has since passed away, but she had been the wife of a pastor. And so she was incredibly skilled at welcoming people and being that sort of social connector. And even with her dementia, she was able to be the welcomer and the person with being the social connector. And she went from table to table. It was really made for her in a lot of ways. So it's a really simple yet profound start to dementia-friendly programming. And it really was the beginning of our dementia-friendly programming, was the Alzheimer's Cafe. Next slide. So how do you start a cafe? So one is to assess interest. If you are running support groups, you can talk to them about it and have a focus group about it at one of those support groups, or do a survey. And I also really suggest, again, depending on who you are as the person who's interested in starting one, is to find a partner. And that partner can be a senior center, like we're a senior center. We ended up being the ones to start it, but you can also go to your local senior center and ask them if they're interested. And as a senior center director, I think most of us have people who have been diagnosed with an early stage memory loss and dementia, who sometimes start to have to leave the center because there's not as much for them to be able to do. And so I think senior centers might be very interested in partnering with you. But service clubs, faith communities can be partners as well. And you really need, a steering committee is great, but just having a champion of some sort is what's most important. Next slide. So the venue. Venues, it's this huge and very important, and there are so many choices. It should be a warm and welcoming space. I bet as I list some of these, or as you're reading them, the perfect space is going to come to you, but it should be a warm and welcoming space, not too busy or noisy. Public cafes are good, where they can provide a space, and public is great because it can break down stigma. Parking and access is important, wheelchair access. Again, you're reading some of this, comfortable furniture. Main thing is some food or beverages to purchase. It should be a place that creates a relaxed environment, not something that's too intense, and it shouldn't have a medical feel or senior care. We really want it to be that sense of normalcy around being out and about. And most importantly, the staff of the venue should be interested and excited to be a partner. Next. Next slide, please.
1 second, Cecily. I'm sorry. I had somebody messaging me wanting to join, and I was trying to send them an invite.
Okay.
And now I am lost the main screen.
Okay, no problem.
Give me 1 second.
Not a problem.
Can you see my screen right now?
I just see starting a cafe venue. I'm on the same slide.
Okay, give me
as I
one
was.
second.
And while you're doing that, so you can see there's a library as one. We've had 3 different places, and I think the next picture might possibly show that. The first one, I'll just talk while it's we're looking for the slide. The first one was the first one who was a cafe that has now since closed because she retired, but it was May's Finney Ridge Cafe. Oh, are you okay? Should I try to find it?
Cecily, give me 1 second. I've got
Yeah.
to pull it back up.
No problem.
I'm sorry to those attending. I just got to pull the PowerPoint up one more time. Give me 1 second.
Not a problem. This is Zoom. We're all still getting used to it. I know I am. Anyway, I'll just mention that. So we had a fabulous cafe, May's Finney Ridge Cafe, and we actually started there, and she was a breakfast place. So we actually did it after breakfast, after her breakfast time, and that worked out really well. And then she actually retired, and we went to another little cafe with a lovely young couple who owned the cafe, and they were so supportive. And as I was mentioning, having supportive staff is extraordinarily important, that they take an interest in what the program is. And then they ended up selling the business, and we finally ended up at a fabulous venue. That's perfect. And there's May's Finney Ridge Cafe. The Ampersand Cafe is the one who sold their business. We loved them. And then finally, and still until COVID, we are at the Stage Door Cafe, which is connected to the Taproot Theater. And what's lovely about that is right before right after our Alzheimer's Cafe, the Taproot Theater offers improv for people living with dementia and their care partners. So it's a fabulous venue, and we look forward to getting back into it. Next slide. And here's some other ones. There's again pre-COVID pre-COVID Alzheimer's Cafe at the Fry Art Museum, Memory Cafe at a restaurant in Tacoma, and then Tutabella. We have done an Alzheimer's Cafe dinner, so at dinner time. The other ones are usually in the daytime. And Tutabella is a fabulous business that has been extraordinarily supportive, and I've actually hosted a number of cafes in different parts of the city, actually. Next slide. Timing, they usually run around an hour and a half to 2 hours. We have been once a month. We try to keep it the same time each month. You might want to look at a time when the venue might be quieter. It is primarily, as I mentioned, about socializing, but we have had themes. We've done Valentine's Day and St. Patrick's Day. We do sing-alongs. We have musicians. We have even done some creative arts and storytelling, but I would say music works the best at the cafes. Although you don't even have to necessarily have it, it's a wonderful break in between. We even had like a little dance kind of thing going on, sort of like a flash mob dance that happened. That was quite fun. Staffing needs, you need one consistent person to act as a host or facilitator. That could be a volunteer or a paid person. That person should be very capable of being welcoming and socializing with people with dementia. And then having some extra set of eyes is also really helpful. So having a few other volunteers or staff, depending on your organization. Next slide. So additional details, how do you get the word out? Create a flyer, and I'll show you some of our flyers. We try to be super colorful and creative with our flyers. Connect with senior centers, as I mentioned, the Alzheimer's Association, of course, to the support groups and the support group leaders. Assisted living facilities, but as I mentioned, for that, it is really about a caregiver coming with a person, sort of one-to-one, maximum 1 to 2. Home care agencies, as I mentioned, also paid caregivers as something to do with the person who they are working with. It's great. And then to get the word out even more is establish relationships with local media. We have been very, very lucky, especially in the beginning, to have the local media be interested in this. And so I just had posted some of the pieces that KUOW did and QFox 13 did about our Alzheimer's cafes. And that helps get the word out, helps people know, oh, there's something like that in my part of Washington. Next slide. And here are some of our flyers, as I mentioned, different themes, colorful, trying to really show how fun it is and how accessible it is. Next slide. So additional information, don't worry if it's starts off small or if there's ebbs and flows. I'm not a numbers person, I have to honestly tell you. So, you know, it's important to sort of see what's going on, but this is a program for people living with dementia and their caregivers, and things come up for people at different times, and people, the disease sometimes moves along, and that where people can't really come anymore, and then it takes time for new people to hear about it. So trying to let go of numbers, expectations, and more about what the people who are coming are experiencing, the joy of being there. No, as I mentioned, no solicitations from outside businesses. It's okay, absolutely, to announce other dementia-friendly programming in the community. This is a resource for people. There's no, we try not to have any kind of sense that it's only about our programming. We want everybody to know about everybody's programming. Themes and activities can be helpful, but not necessary. We have done reminder calls to at least the core group of people, reminding people with emails or reminder calls. Name tags are helpful for everybody, so I highly recommend name tags. We use social media to advertise as well. A lot of people are obviously on social media, so we use that as well. Next slide. And best source of how it's going are the attendees. So ask for feedback. They will give it to you, and it's good. There's lots of information about Alzheimer's cafes. So I'm not going to go into a lot of detail about these. You can Google it. There are, you will get the slides. So these are on here as well. There are toolkits. You have to look. Vig did a book about Alzheimer's cafes. So there's lots there. Next slide. And these are just some of the quotes from some of our, from some of the different Alzheimer's cafes. What people love about them, the importance of them. So, we know that this is a meaningful program for people. Next slide. And again, more information, more than I can go over here. But one I definitely want to tell you about for sure is Momenta Seattle. Because there are, it tells you a lot about the many Alzheimer's cafes that are going on, but also the dementia-friendly programs that are going on that, in all honesty, I sort of feel like Bill came out of these early programs like Alzheimer's cafes, and just more and more people and more creativity and more engagement with people who are living with memory loss and their care partners and putting them as a focus. So definitely connecting with Momenta Seattle is extraordinarily important. And there is a Facebook group regarding Alzheimer's cafes and memory cafes. So those are just a few of the ones that I want to highlight. And finally, I am always available for any support that anybody needs. And you can find me at the Greenwood Senior Center, which is a senior center program of the Finney Neighborhood Association. Love and always there to help. Thank you so very much.
Thank you so much, Cecily, for that. I'm going to now stop sharing my screen. Cayce.
Hi, everyone. It's so great. Good morning. It's so good to be together and joining from all across Washington State and meeting virtually, which makes things easier in some ways and more challenging in other ways. I'm the Dementia-Friendly Recreation Specialist for the Seattle Parks and Recreation Department. And I want to start by acknowledging that we are on Indigenous land. Where I am here in Seattle is the traditional territory of the Coast Salish peoples, specifically the Duwamish tribe. And I'm going to talk about dementia-friendly walking groups as a program. But before I do that, as we were preparing for this conference, I think both Cecily and I are really talking about pre-pandemic times. So I think we're really all grappling with what the future will look like. There's a lot of uncertainty, but because there are different conditions with the pandemic across the state, different levels of reopening can happen at different times. And now, while things are sort of on hold, is a good time for planning for the future. Also, walking groups, because they generally are outdoors, may be a program that's possible sooner than other programs that need to be inside. So preparing for that possibility. And then also just, recognizing, I think right now that it is nice to have something that we can hope for when we can be together. We will all be changed by this. Into the future, but just the hope and possibility of kind of planning for some of these things that are so meaningful in the community. And I've added some COVID considerations in red at the bottom of the slides. I do want to say that these are just things that I'm thinking about right now. They're certainly not comprehensive, just kind of some little notes that I wanted to put in to just address of like where we are right now. So a brief history of dementia-friendly walking groups in Washington. So these programs are social and physical engagement opportunities for people living with memory loss and their loved ones. They are what they sound like. It's just a chance to get together, to get outside, to build community. And I'm going to share about various considerations for these programs, but want to just quickly say, in case, I run out of time to cover everything, there is a Dementia Action Collaborative Guide that covers everything I am going to talk about, and I share the link at the end. So like with the Alzheimer's Cafes that Cecily shared about, there are these how-to guides that a lot of thought went into, and so there's definitely a guide for you moving forward with thinking about starting a program like this. And so I'm like distracted by so many things. Like my dog barking outside. I'm like, did he escape? And then also, so here's just a history, and this is from 2011. I would love to hear going through 2017. So I haven't updated it, and I know that these programs have really been just kind of blossoming in a lot of places. So if there are ones that aren't included here, I would love if folks would share those in the chat box. But as you can see, anywhere from Seattle and Tacoma, Bellevue, Edmond, so north and south, Lacey, and also hosted by a variety of different organizations. So like Cecily pointed out with Alzheimer's Cafe, These really can be spearheaded in the community by community members. Different kinds of organizations can come together to create the program and partner. So the benefits, I think, feel more apparent now, maybe than ever before, as many of us are just feeling very stuck at home and isolated. These programs blend physical and social activity into one program, and we know that exercise and social connection have tremendous health benefits for all of us, and particularly older adults. Dementia-friendly walking groups really promote health. They reduce feelings of isolation, improve overall quality of life for both the person with the memory loss and, importantly, also for their care partners. And I'd like to add, I think what I see is creativity around what these walking groups can look like. So depending on where they're happening and depending on the leadership and the interests of the group, there are also opportunities for creative engagement, for learning new things. So whether it's sharing poetry along the walk or viewing artwork, learning about plants and animals and nature, or learning about the history of the community that you live in. So there are really opportunities for connection and for personal growth. The question of who attends these programs, I think, is an important one to address. And so initially, just like with an Alzheimer's Cafe, getting community input is a really important place to start. Perhaps there are community members living with dementia, or current care partners, or former care partners who are eager to start a group or have ideas about where to walk. And really starting with that place of community input and buy-in, it might then become clear, what this group is and who it's intended for. So I'll talk a little bit about some of the ways that this can kind of look differently, but we really see success in all of these different models. So for example, you might have an early stage specific memory loss walking group. So here in Seattle, we have the Alzheimer's Association hosts Zoo Walks in partnership with Parks and Rec and Greenwood Senior Center. And the intention around it being specific to early stage is that this can promote a group dynamic that is more conducive to peer support and sort of facing similar challenges, both the person living with dementia and the care partners kind of being in some of the same places. That being said, we all know that dementia does affect people in different ways and that it can be really murky. Stages are hard to define. So there are benefits and there might be, some drawbacks to limiting by stage. When a group is not specific to stage and more based on the individual, this can allow for more fluidity. It really allows us to focus on the individual, but it also comes with increased challenges, whether it's for the cohesion of the group, if there are varying levels of mobility and cognitive ability, and you might just really need more support from volunteers to help the group, whether it's connecting or going on the walk. And then also, I think an important consideration, and Cecily addressed it as well, is this idea of challenging and reducing stigma. So sometimes a walking group might be open to the general public, inclusive of people with dementia and care partners, but open to anyone who's interested to join. And this really promotes the idea of full community integration and reducing stigma. And with this model, there's considerations about really thinking about the role of volunteers and being attentive to the needs of people with memory loss, facilitating connections between members who have memory loss or don't have memory loss. So pros and cons, just sort of different considerations to think about. And then certainly across the board, you're kind of thinking about what's the level of screening required as someone's wanting to join the group, and what are those safety concerns for the group as a whole. So I want to pause here and share about a specific program. The Garden Discovery Walks are a good example of a program that has worked well for people kind of across the continuum of early to later stages of memory loss. And that's because of a couple things that I'll share about. This program was developed with the input and leadership of community members affected by memory loss, both care partners and people living with dementia, and really around this passion for gardening and nature and wanting to explore. We offer this program in partnership with UW Memory and Brain Wellness Center. And for the past several years, this walk has taken place once a month in different public gardens in the Seattle area. Each one starts with a mindfulness exercise and some stretching and really preparing the group to walk through the garden in this kind of mindful way. So a slow walk, observing with all the senses. And this is one of the parts that really has made it work well for all levels of memory loss. That idea of being in the moment is really what's key with this program. And then each walk has been followed by a horticulture therapy activity led by horticulture therapist, Laura Rump. And she really works with a lot of different people and, really leading an activity each time that works well for a lot of different abilities. So because of the slow pace, the emphasis on being in the moment, it has worked well for various mobility and memory loss levels. Since the pandemic, I will share, Laura Rump has been recording virtual garden walks and nature activity sessions. So these are YouTube videos that are up on the Memory and Brain Wellness Center. I have the link to those videos at the end. So at this time, anyone that has access to watching YouTube can go on a garden discovery walk, exploring some of the familiar places that our group has visited over the years, but also some new places that we hadn't gotten to yet. And then, you're led in a process of an art project or nature project. Considering location, the sort of where and when of the walking group, endless possibilities. Also, like with Alzheimer's Cafes, these really can take place anywhere in the community. And because, the distance, the length of the walk will vary, it's really about just finding the right fit for you and your community and the group that you're focused on. So it might be parks, zoos, museums, botanical gardens, malls, and different routes throughout different neighborhoods. Some programs visit the same location each week. So the zoo walk, like I mentioned, you're returning to the zoo. The zoo is very big, so actually you're exploring different parts of the zoo each time, but you're coming back, you're meeting in the same place, you have that familiarity. And that consistency really allows for easier planning in some ways and coordination. Folks know where to go, you know where to meet. And then other programs might change location. So the garden discovery walks each month is a new garden to explore. And this allows for that, learning about your community, kind of going to new places in a supported way. I know that's something for people with memory loss and care partners wanting to get out and about, but maybe feeling like it's feeling hard to do that on your own. So getting to do that with a group. There is certainly, though, a high level of planning and organization and communication required to really make sure that everybody knows where to go and knows what to expect. So those reminder emails and certainly including a map and description of locations. And I'm going to share a little bit about another walk that changes location each time called Out and About. As far as frequency goes, the walking groups that I've been involved with and know of really meet maybe weekly or twice a month or monthly, but having something at least once a month, I think, in a regular way. Some walks, don't meet during the winter, but some walks meet year round and are thinking about considerations for that. And then also, generally, the walks that we've been doing here in Seattle have been in the morning with some sort of social time over lunch. But I think it really depends on, what works for the group and volunteers. So we're thinking about the where and when. There are just really some universal points to think about with location and with walking routes. And like Cecily pointed out, this is the sort of, this make it or break it kind of thing. This is the success of the group depends on this, thinking about this location. So safety and accessibility, definitely a primary focus when you're choosing a walking site. Things to think about, generally flat surfaces, accessible pathways, how crowded the area is, and obviously these things become even more relevant as long as COVID is, around, thinking about crowding. If the group plans together in a cafe following the walk, it's important to really ensure you have that same dementia-friendly and accessibility lens to that space. Is there room for the group? Just thinking about all of those aspects, like we heard about yesterday, and thinking about dementia-friendly businesses. And for those considering rotating locations, it's definitely helpful to, there's a lot of effort that goes into really scouting out the walking routes and making sure that participants are prepared for the upcoming walk, and mentioning if it's pavement or if it's gravel or just any kind of things like that, so participants can plan accordingly. Restrooms, always important, thinking about the availability of those on the walking route, thinking about how accessible they are as well. The fact that there is a tiny porta potty, along the way might not actually be ideal. So just really thinking about that folks will have their needs met along the way. And certainly, at least at the beginning and end of the walk, if not along the way. If you're walking in a location that has an entry fee, such as a museum or zoo, one of the benefits of a program like this is that, walking is free. It can happen anywhere. So really thinking about the costs and ways to reduce and eliminate any barriers that might create. We've found that museums and zoos are very eager to collaborate and offer free, an aquarium for that matter, offering free entry to groups like ours, and that partnership goes a long way. It also, if you're going to have lunch somewhere, thinking about the affordability of that location of a restaurant or cafe, and just making sure, regardless of what the costs are, that participants are aware of what's their responsibility to participate. And as far as distance and pacing, to me, this has really felt like it's come up as a very important thing to consider for the cohesion of the group. So this will vary depending on the goals of the program, the abilities of the group members, and in my experience might sort of change over time as people kind of come together and join those connections, but then also as memory loss progresses. So longer walks, moving at a faster pace, covering more ground, that requires a faster pace if you're covering more ground. Whereas the garden discovery walks, that slow movement and attention to detail, the pace matters less there. So this should be really communicated to prospective group members through a screening process. And additionally, because in my experience, it's very hard to assess someone's pace or mobility over the phone, is a trial visit. So maybe having folks attend a couple of times to see if it's a good fit and really make sure that it's going to work well for the group and for the new members. And it really just comes back to safety, which we'll talk a little bit more about as well.
Okay.
Finally,
Cecily, I believe we're running short on time.
Oh, I thought we had until 10:15 and then we were doing Q&A until 10:30.
Okay, is that, are you going till 10:15?
Oh.
Okay, no worries.
Well, I'll hurry along, and thank you for that.
Yeah, no worries.
So I realized I might have gotten the timing confusing on my part. So anyway, just thinking about accessibility in other ways as well, transportation and parking. We cover this in the guide, the how-to guide. Driving is a very complicated thing for folks with memory loss and just brings up a lot. So just being ready to troubleshoot transportation issues is a really important thing. So I want to make sure I get to talk about leadership and volunteers. So, volunteers, in my experience with these groups, volunteers are everything, providing all of the leadership the day of and on the ground, as well as planning and organizing, and really bringing the group together and nurturing those connections. We offer a little bit about ideas about how many volunteers to walkers, but I think, that really kind of depends on the group and the needs of the group. Things to consider, just really having clearly defined roles. So, walking groups are a mobile program. There's a lot of communication required. So having that key person that people know to contact the day of, they have their phone number, and they're going to be in communication, making sure nobody gets left behind, that kind of thing. Just kind of really tending to the group and the safety of everyone, and thinking about these relationships between participants are really important, and the relationships between volunteers and the participants are very important. So thinking about folks who have a passion around this work, folks who maybe have some personal experience with dementia, and really have incentives to stick around. I know a lot of the volunteers who've been leading walking groups in our area have been doing it for a really long time. They really love it. They love the fresh air and connection and socialization, and really making sure to have ways to sustain them in the program. So I want to talk quickly about out and about walks. This is a great example of the importance of community leadership, and then also just the volunteer leadership. So this program was founded in 2014 by community members Nancy and Steve Olson, who you see here. The Olsons were already involved in senior walking groups, and when Steve was diagnosed with dementia, they decided it was important to keep walking and also connect with other people who were on the same journey as them. And it's really been Nancy's dedication to the program that has carried it forward. So now there are 8 other volunteers along with her who rotate leading these walks, carefully planning routes through different neighborhoods and parks that are 2 to 3 miles long. They make sure to highlight points of interest, so there's opportunities for learning. There's a poem shared on each walk, and then the group ends with lunch and socializing together. And there is a video that you can see on the Dementia-Friendly Recreation webpage that just shows this group in real life, pre-pandemic, doing their walk together. Thinking about registration and communications, just again, it goes back to the dynamic quality of a walking group. It's mobile, so really thinking about screening for folks, making sure participants know what to expect, making sure volunteers know what to expect and how to support folks. And then also that you have clear communication policies the day of. So people let you know if they're coming or if they're not coming or if they're running late, just really clear communication on all sides. Finally, some just policy considerations, and again, the guide, the how-to guide really goes into this with some examples that you can use. So just thinking about liability, there are some inherent risks of walking out in the community related to falls or just safety. So really thinking that through for yourself and for your group, for your organization and your volunteers. Thinking about transitions. And Cecily touched on this a little bit, but this is just relevant with any dementia-friendly program, is that, things progress and the fit for someone is going to change, especially with a walking group. I think it does come up a little more. So thinking about where you can direct people if the walk is no longer a good fit, such as an Alzheimer's Cafe. I think those are often a good place to continue having those connections. And then bereavement, as if someone passes away, someone with memory loss, their care partner might still want to be a part of that group, that they become close and have those connections. So just thinking about policies that can help support everyone through what are very difficult transitions. And just a weather policy. So I'll say it like everybody's different. Some of us don't want to be out in the rain in Seattle, but it does rain a lot here. So thinking about what is your policy, you know, and having a clear communication about it. The out and about walks, they go rain or shine in all kinds of weather, except for ice and snow. So just having a really clear policy to help everybody out with that. I think I'll skip the marketing, but just Cecily kind of shared all you would need to know about marketing a program like this or an Alzheimer's Cafe. And then I'll just end with this slide, building a sense of community. So this really is why this program exists. I hear and see that people really become like family to each other and a really important support system. So like with the Alzheimer's Cafes, you know, things that support that, name tags so people can know each other, celebrating often, you know, finding things to celebrate together, birthdays and anniversaries and holidays, out and about, always has a holiday party every year and celebrated the 5th anniversary of the program starting. And then again, just the role of volunteers in providing the personal touch with reminders and following up with folks that really helps build that sense of community and belonging. That if you miss a group, people did miss you and someone's there to check on you. And with that, I will end. Here are some resources. So the top one is the guide for community organizations. That's the how-to guide from the Dementia Action Collaborative. There's some great UK, just like with Alzheimer's Cafes, I think, you know, they're sort of ahead of the curve. They have some great dementia-friendly walking projects, resources. The virtual garden discovery walks that I mentioned, you can go and look. Since April, we've been having those virtual garden walks and horticulture activities. And then the video about the out and about walks. And finally, of course, I'm happy to be a resource to you. I'm always excited to hear about what things people are getting started. And I'll add you to my slide when you start your dementia-friendly walking group when we're able to do that in the future. And hopefully we can continue to be a resource for each other as we, you know, sort of see where all of this leads us. So I'll end there and looking forward to answering some questions.